Happy New Year, happy 2018. Welcome. This is the day 7 of the 12 days of articles in review. My name is Mary Coughlin, and I'm the president and founder of Caring Essentials Collaborative. So, kicking off the new year, today's assortment of papers are going to talk about the phenomenon of missed care in nursing. And I know many of you have heard me talk about this subject before. I find it really fascinating. I think it's awesome that folks are really digging in and trying to really understand this phenomenon. And in fact, there's a recent publication, which I, of course, purchased by B. Kalish, who's kind of the primary nurse researcher on this phenomenon, which is pretty ubiquitous across all nursing specialties. And the reason why this is a big deal is because missed care is an error. It's a medical error. It's an error of omission. And in a recent paper that is going to kind of be the highlight of my review today by Lake et al., she looks at this phenomenon of missed nursing care in pediatrics. And specifically, she looks at NICU, PICU, and then general peds wards and the frequency. She surveyed over 2,000 nurses from over 200 clinical areas, hospitals, and indeed discovered that there continues to be a challenge that greater than 50% of nurses self-report missing at least one nursing care on the prior shift worked. And what this means for pediatric populations is pretty significant, because when you think about pediatric patient populations, whether they're neonates or infants or toddlers, this is a highly vulnerable class of patients. And so missing care for this group really could have some pretty substantial consequences. The cares that are most frequently missed that have been reported across these groups, all right, general acute care, PICU, and NICU, are care planning, comfort care, patient teaching, discharge preparation, documentation, medications administered on time, skin care. Pain management was reported, but it was a very low percentage, but still of concern when you think about the vulnerability of this patient population. Other authors have investigated this phenomenon specifically within the neonatal intensive care clinical setting, and the two authors for those include Tubbs Cooley and her team, and then Rochefort and Clark. They're out of Canada. Tubbs Cooley did an initial survey of the frequency of missed care, and certainly I think one of the top the top one was nursing participation on rounds. That it was well over 50% of nurses reported not participating on rounds. And it may seem like not a big deal, especially when you've got a lot of competing priorities, but your lack of presence on rounds then does not provide a voice for that patient. Patient is more than a sum of their vital signs, their lab results. You, as the nurse, provide that 360 picture and information that's really relevant when we're doing care planning and rounding on these patients. And so your lack of presence, and I know it's multifactorial, it's a complicated situation, but really doesn't serve the patient well. The fact that comfort care and discharge planning are high on that list of missed care is very concerning as well, in addition to discharge preparation. In a recent paper by Rochefort and Clark, they looked at the link of poor discharge preparation and hospital readmission, and lo and behold, there was a link. There was a higher readmission rate for those patients that had compromised discharge preparation. In a follow-up paper by Tubbs Cooley, they looked at the implications of missing oral feeding encounters when the infant exhibited feeding readiness behaviors, right? So as a nurse, you could relate to this, right? You're busy, maybe your other patient is crying or fussing, or the family's come in, and this baby might be like, really eager to feed, but you're crushed for time. So you say, okay, maybe next time, and you just pour the feeding into the syringe and move on your merry way. And what they discovered is when that occurs, it actually extends the patient's hospital stay and, of course, delays the time to full oral feedings. And, besides the fact that it's not the ideal practice, right? It certainly is not the best practice. But there's now economic consequences, and the longer we keep these individuals in the hospital, the longer we delay, them transitioning to a more therapeutic, natural environment that optimizes their growth and development and that sort of thing. So it really is a big deal. Now, as we start peeling back the layers, if you will, to understand, okay, so this happens, why does this happen? These researchers have also investigated that as well. And there's just a lot of very valid, as a nurse, I understand what you're saying. I'm just scrolling down to find the reasons here. Frequent interruptions, urgent patient situations, an acute decompensation of a patient. When parents aren't available, it does limit our ability to offer full comfort care for these individuals. Medications aren't available on the unit, unbalanced patient assignments, inadequate number of nursing, and that kind of spins me over to another recent study that was really interesting, again by Tubbs Cooley, 2017, I want to say. Yes, it was. And they looked at, okay, so missed nursing care is a problem. I wonder if it's less of a problem in magnet-designated hospitals, magnet-recognized hospitals, because of course, this whole idea about magnet recognition is about the quality of nursing care and all that kind of stuff. And so what she discovered was that indeed, missed nursing care in NICUs occurs regardless of hospital magnet recognition. However, the reasons for the missed nursing care systematically differ in magnet and non-magnet hospitals. And of course, their recommendations are to continue further exploration to understand this. Now, poor work environments are most assuredly related to this phenomenon of missed nursing care, but it's not just poor professional environments with relation to the number of staff, but it's also the configuration of staff and other variables. So, just throwing more FTEs in the pot doesn't necessarily correct the situation, that it requires more deep scrutiny and evaluation to really understand what's going on, what's the problem, and why are we struggling to reduce the incidence of missed nursing care, particularly in the pediatric patient population, in the NICU more specifically. So what I'll do is I'll share these citations of the Lake paper, that's the 2017 in the PEDS, the Tubbs Cooley paper looking at the magnet, and then the other ones that look at more specific clinical practice outcomes as a result of missed nursing care. And then I invite you, give me your feedback. I really want to hear what you have to say. Do you experience this in your environment? And again, I know my default setting I think of as a nurse, but there was actually some really interesting papers that looked at this phenomenon around medical practice too, that some of the time constraints around physicians also predisposes them to the phenomenon of missed care. What about rehab services? I haven't seen anything in the literature, but do you guys experience this phenomenon as well? We've all got competing priorities. We all struggle with time scarcity. How are we addressing that in a meaningful way? And can we bring our creative and insightful ideas and potential solutions to the forefront and really discuss this and address it in a more meaningful way so that we can really eradicate this phenomenon, which really does undermine quality and patient safety. So on that note, I look forward to your feedback. I'll be posting this up shortly, and great way to kick off 2018. I'll see you guys all tomorrow. Toodaloo. Bye.